Welcome to the University of Maryland School of Dentistry info session for the program of dental hygiene. My name is Lisa Bress. I've been a faculty member at the University of Maryland School of Dentistry for 25 years. I graduated from the University of Maryland with a bachelor's degree in dental hygiene and a master's degree in dental hygiene. And it's my pleasure to tell you about the program. So first of all, you're here because you want to be a healthcare provider. Being a healthcare provider, period, is a very powerful thing. And depending upon what area of the body you want to concentrate on, it's something that you can do to make a difference with individual patients and out in the community. I'm here to talk about what it's like to be an oral health provider and what you can do with it with a degree in oral health at the bachelor's level and at the master's level. So first of all, dental caries or cavities are preventable. It is not the type of disease that you absolutely have to get. These pictures are of children, and this particular picture is a child who is suffering from an infection. This doesn't happen overnight. This is a picture of just rampant decay, and this is infection. This is very painful, and it is preventable. In adults, this happens as well. When teeth look like this makes it difficult for individuals to eat properly, talk, think, work, go to school, hold a job, live a quality life, live a happy life. Here, this is a picture of periodontal disease. Periodontal disease is a disease, an infection of the structure that holds the teeth in. So if there's an ongoing infection in the area that holds the teeth in, then the teeth lose their support, and that's how teeth become long like this and loose. In dental hygiene, our primary focus is prevention, oral cancer as well. Oral cancer kills. Oral cancer, about 9,570 people died during this particular study. In oral health, we screen for oral cancer with every patient. So being an oral health provider can save lives. When folks don't have health insurance, don't have a dentist, don't know where to go, or just wait to go to the dentist because they're afraid, they often end up in the emergency room because they're in pain. And these emergency department visits are preventable and unnecessary. In 2016, there was a study, and over $22 million in Maryland was spent on preventable dental infections. 15 adults died during this year, too, because patients go to the emergency room. There very often, or more often, is not an oral surgeon or a dentist to address the primary reason one would have a dental emergency of this type. They're given an antibiotic, a pain med, and told to go to a dentist. Very often, the pain leaves, they feel better, and they don't go to a dentist because it's not covered. What happens? They go back. They end up going back to the emergency room. Then they're often admitted because this infection can go on to their brains, and this is what kills folks. In fact, it killed a little boy in 2007 named Diamante Driver in PG County, Maryland, and a lot changed in oral health after that. So we dental hygienists at the bachelor's level and at the master's level can really make a difference with our patients, the community, and health providers inside and outside dentistry, being a dental hygienist. So we have programs at the bachelor's level, which is 2 years. The first 2 years students would do 57 credits of prerequisite courses. We are the only program in the state with a bachelor's degree. The difference between a bachelor's and associate's degree to treat patients, to be a clinical dental hygienist, to work in a private practice, there's not much of a difference. We often make the same amount of money. We take the same licensing exam. And these other programs are great. But if you want to do more with your career, it's great to get a bachelor's degree because the education is very important. No one can ever take it away from you, and you can go on to get a bachelor's degree. If you are a student at UMBC, then you are often getting a bachelor's there. You can utilize that bachelor's to become a dental hygienist and earn a master's degree at the same time. So our program at the dental school is here. I just wanted to show a couple pictures. This is the lobby, our atrium. This is the outside of our dental school. The first year of either program, the bachelor's or the master's, students spend some time in the simulation lab learning all the different instruments and procedures, first on mannequins before they get to the clinic. Once in the clinic, they learn on each other all the different procedures, including local anesthesia and nitrous oxide. Students become certified, licensed in nitrous oxide and local anesthesia before they graduate. We work with the schools outside the dental school, like the medical school, the nursing school, the pharmacy school, different programs. This particular one is a prenatal oral health program where our students, before COVID, would go in and provide oral health screenings and education to pregnant patients as they wait for their obstetrician to come in the room. Our students also provide professional presentations while in our program. They do case history presentations. They choose a complex case that they research and present this case to their classmates and faculty. This can go on to be an article or a poster. Our students present professional posters at Public Health Research Day at the University of Maryland School of Public Health. And if selected, they present their poster at the American Dental Hygienists Association each year. All expense paid for the group who gets selected. This past year, because of COVID, it was a virtual annual conference. So we put the poster up in our bulletin board in the dental hygiene hallway, and these are our graduates. Orientation last year was a little bit different, but still goes on. We had a virtual orientation, as I'm sure all of you are dealing with COVID-19 at your school. To talk about our new program at the universities at Shady Grove is this: you can earn a bachelor's degree in dental hygiene and a master's degree for just 2 extra summers. This program requires students to have a bachelor's degree in another field in addition to the 57 prerequisite courses. The clinic and the labs take place at the new Biomedical Sciences and Engineering building at the universities at Shady Grove. So what do you do with a degree in dental hygiene and a master's degree? There are leadership positions. For example, the new rage, the very big thing in healthcare now is to have medical, dental, electronic patient records, so that when a patient sees a physician and then they see a dentist, the dentist doesn't have to take a whole new medical history. They can go in and see what medications and other syndromes or diseases or issues the patient may have. We need more of that. We need a dental hygienist with a master's degree to work with software to make medical dental records. There are a few, but there needs to be more. Federally qualified health centers often have medical offices like women's health centers, primary care facilities, and many are popping up with dental clinics. We need dental hygienists with a master's degree to lead these efforts, to develop programs for prenatal oral health, for pediatric dental health. Director of Clinical Operations for a primary care clinic? Absolutely, as oral health becomes part of overall health care. A dental hygienist with a master's degree could be the clinic administrator. Senior centers, retirement homes, nursing home facilities, there's a law now that dental hygienists can provide care in these facilities without a dentist. A dental hygienist with a master's degree could write grants, develop programs, and administrate these programs in these care facilities. County health departments, right now in Cecil County, there is a position vacant for the director of health promotion in their county health department. Usually this position, or for the past several years, was filled by a nurse with a master's degree. They do sealing programs in the schools. They do fluoride varnish programs where they provide oral health screenings and education to children in Title I schools. A dental hygienist with a master's degree would be perfect to fill this vacancy. They need more dental hygienists with master's degrees to address the national oral health crisis that is going on and becoming even worse due to COVID-19, with many folks delaying their dental appointments for fear of contracting COVID. Federally funded grant programs, these types of programs are federally funded through HRSA, Health Resources Service Administration, grants millions of dollars a year in projects. A dental hygienist will be able to balance work and family, managing a program such as one I know of. A colleague manages 5 states with programs that integrate oral health into primary care, all from her home, working with different health professionals in 5 states with these programs. Nonprofit organizations such as the Maryland Dental Action Coalition, I suggest that you Google it. It's a nonprofit organization to advance oral health in the state of Maryland. Research, education. We at the University of Maryland, the faculty, have master's degrees, and working with students, we learn every day. It's quite rewarding as well. So I wanted to show you a few pictures of our new program called the Clinical Dental Hygiene Leader. And this is the Biomedical Sciences and Engineering building at the Universities of Shady Grove. This is the atrium area, and here are our first class of students. They started in June 2020. We accepted 4, and they're sitting all with their masks because of COVID in the atrium area. This is the waiting room of the dental center. Very modern ADEC equipment in the dental center. Here's an operatory with 2 screens. It's just gorgeous. An amazing facility. We have a Panorex machine that would enable someone in a wheelchair to just roll up. Beautiful windows. Here are our students the first week of clinic as they're learning vital signs in all their new PPE. This is the simulation lab at the Universities of Shady Grove. Notice there's social distancing, there's plenty of room in this very high-tech, beautiful facility. So the application process for both our programs begins January 1st. The deadline is February 1st. And if you have any questions about what credits you need, what classes you need, you can email me. It is also right on the website. One big change is that due to the mail right now and COVID and the election, All the directions are on our website, but they're asking that we email letters of recommendation and transcripts to the admissions office rather than send them via snail mail. Another change is that general biology and our chemistry courses and organic chemistry courses, they will be accepted. It doesn't matter how old they are. It used to be a 5-year limit. Now there is no limit. In terms of the anatomy, physiology 1 and 2 courses, the microbiology, the nutrition, all must be within 7 years of the start date with which you wish to be considered. Artsys is a website that I strongly recommend you visit. It is a website that you can plug in a community college. If you choose to take some of your credits at a community college, those courses that are accepted at our school, University of Maryland, Baltimore, are listed, and I can certainly help you with that. We fill out an advising sheet on every prospective student who wishes to have advising, and I take a look at your transcripts and I let you know what else you need to take to be eligible to apply. So that's the end of my presentation. My email address is lbress@umaryland.edu. I'm just an email away and would be very willing to answer any questions that you may have.